Welcome to the deep dive. This is where we take a mountain of research, all the papers, the data, and we try to distill it down into the most critical insights, the things that, might genuinely change how you see the world.
And our mission today is, it's a heavy one, but it's absolutely essential.
It is. We're diving into a massive systematic analysis. This was done for the Global Burden of Disease Study, the GBD 2023. And it's tackling a subject that for a long time has been seen as a social issue, maybe a criminal justice issue, but not what this study says it is.
Which is a quantifiable public health crisis.
Exactly. We're talking about the worldwide health burden that's driven by violence.
That's right. And the focus is on two really specific, devastating factors. Intimate partner violence, which we'll call IPV, and sexual violence against children, or SVAC.
Okay.
I mean, these are obviously human rights violations. We all know that. But what this GBD analysis really brings to light is that despite their widespread, just catastrophic effects, they have been historically under-prioritized.
As drivers of global disease and disability.
As major drivers, yes. And that lack of prioritization has real-world consequences. It costs lives, causes immense suffering that's often just completely hidden.
So the goal here is to pull those hidden costs out into the open, to provide comprehensive, really reliable estimates that global leaders, health ministries, funders...
That can no longer dismiss.
Right.
Precisely.
Yeah.
You need reliable data to make smart investments. So we're going to show you exactly where these risk factors rank compared to the headline diseases we all know, and then we'll drill down into the specific health costs, which, as you'll see, are overwhelmingly psychiatric.
Okay, let's unpack this, and I think we have to start with the sheer scale of exposure. Before we can even talk about the burden, we have to grasp the prevalence.
Just how many people?
Just how many people globally have ever been exposed to this kind of violence. These are the estimates for 2023, and they're overwhelming.
Yeah, they are. Let's start with ITV. The study estimated that 608 million females aged 15 and older globally had ever been exposed to intimate partner violence.
608 million. That is just an astonishing figure.
It is, and that spans every single country, every region of the world.
If you just pause on that for a second, that's almost twice the population of the United States, and that's just IPV.
Right.
So when you broaden the scope to include sexual violence against children, the number gets even bigger, doesn't it? It points to this profound generational cycle of trauma.
And that's where the analysis, it's truly shocking. The GBD estimated that 1.01 billion individuals aged 15 and older, so over 1 billion people,
A billion.
had experienced sexual violence during their childhood. And that statistic covers both males and females. It just immediately reveals this massive population living with the long-term cascading consequences of trauma.
1 billion people. That's 1 out of every 8 adults on the planet carrying that weight. Before we get into the impact the dailies, can we just quickly touch on the methodology? Because getting these numbers can't be easy.
No, it's a crucial point. We're talking about things people rarely report. Right?
Exactly.
So given the sensitive nature, the authors had to work really hard to get reliable estimates. They searched these huge global databases for any self-reported data, but they knew, of course, that underreporting would be a massive factor.
So how did they account for that? What did they do?
They used advanced statistical modeling. So they took into account things like regional differences, social norms, the quality of reporting systems in different countries, and used that to generate more reliable prevalence estimates and, fill in the gaps.
And then they measured the impact.
Right. And they measured the impact using the core metric of the GBD, which is the disability adjusted life year, or daily.
We've talked about dailies before, but just as a quick reminder for you, the listener, a daily is the currency of global health. It's basically 1 lost year of healthy life.
Yes. It's the sum of years you lose to dying early and the years you live with a disability. It's really the best tool we have to compare the actual impact of, say, a mental health disorder directly against something like an infectious disease. It lets you do an apples-to-apples comparison.
Which brings us to the core of this deep dive, the actual disease burden, the what we're calling the daily shock. We know the prevalence is massive. Now let's look at the quantifiable costs.
And the burden is staggering. IPV among females was responsible for 18.5 million dailies in 2023 alone.
18.5 million.
And then SVACs, which impacts both males and females, attributed an even higher number, 32.2 million dailies in 2023.
So if you combine those, you're looking at over 50 million lost years of healthy life in a single year. 50 million dailies. That figure is almost impossible to grasp on its own.
It is.
But this is where it gets really interesting, and I think this is what changes the public health conversation. How do those daily figures stack up against the diseases that make global headlines all the time?
This is the crux of it. This is why this study is so important. If you look at the ranking among a key demographic females aged 15 to 49 years, IPV and SVASAC were among the absolute top contributors to the global disease burden in 2023.
Okay, so give us the ranking. Where do they land?
All right. Intimate partner violence ranked as the fourth leading risk factor for dailies in this demographic.
The fourth.
And sexual violence against children, ranked right behind it, coming in as the fifth leading risk factor for dailies in that same group.
Fourth and fifth. Let's really pause on that, because those are not minor factors. When we talk about global health priorities, we're talking about the top 10 list. To be at number 4, what is IPV actually ranking ahead of?
It's ranking ahead of many conditions that get enormous, dedicated, multi-billion-dollar global health investments. We're talking about IPV being ranked higher than tuberculosis in this demographic, higher than road injuries, higher than many common cancers. In some regions, its burden is comparable to HIV/AIDS.
That is a tectonic shift in perspective. It means that if you're a global health funder or, a minister of health, and your job is to maximize healthy life years, you simply cannot treat violence as a secondary issue anymore.
You can't. The data proves it.
IPV and SVAC are fundamentally major, quantifiable public health crises. They need to be approached with the same urgency as an infectious disease outbreak.
That study gives us undeniable evidence. The social and psychological effects of violence, they translate directly and dramatically into a measurable disease burden that often eclipses risk factors that have monopolized our attention for decades.
Okay, so let's move on and unpack the specific consequences. We know the burden is massive, but where is the damage actually landing? What specific health outcomes are driving that huge daily count?
Well, the study looked at a whole range of outcomes, everything from physical health, chronic pain, infectious diseases like HIV, substance use disorders. But, and this is crucial, the analysis found that mental health disorders account for the greatest share of the overall disease burden.
For both IPV and SVAC?
For both. The invisible injury is creating the visible crisis in the data.
So let's look at IPV first. The analysis found 8 distinct health outcomes that were associated with it.
And the mental health parts are just dominant. The single leading cause of IPV-attributed dailies was anxiety disorders.
Just anxiety alone?
Yes, accounting for a massive 5.43 million dailies in 2023.
Over 5 million lost years of healthy life just from anxiety disorders triggered by intimate partner violence.
Correct. And the second leading cause wasn't far behind. It was major depressive disorder, which accounted for 3.96 million dailies. So when we talk about IPV, the data confirms it's one of the most significant global drivers of chronic anxiety and depression.
That sort of sustained terror and lack of safety.
Yes, the continuous fear, the control, the psychological distress. It creates these long-lasting changes in the brain's stress response systems. It translates directly into pervasive, debilitating anxiety and depression.
Okay, now let's turn to the burden from SVCC. The list of associated health outcomes there is even broader, right? 14 in total.
It is. The outcomes linked to SVAC are highly complex. They span mental health, substance use, even chronic physical health conditions. But the mental health burden is paramount here too. The specific disorders are they're a bit different, and they reflect the unique neurobiological impact of childhood trauma.
So what stands out in that SVAC data?
The leading cause of SVAC-attributed burden was self-harm, accounting for a devastating 6.71 million dailies.
Self-harm.
Yes. And this shows the really severe, life-altering nature of the distress that's caused by childhood sexual violence. It's a direct line from that childhood trauma to, potentially fatal coping mechanisms later in life.
It reflects a profound disruption of the ability to regulate overwhelming emotion.
Exactly. The link between SPC and self-harm isn't surprising when you realize that chronic childhood trauma just is. It severely disrupts the development of healthy emotional regulation. For so many survivors, self-harm becomes this desperate, though maladaptive way to manage that pain.
And there was another less intuitive link you mentioned, schizophrenia.
Yes, and this is another one of those shocking data points that highlights the long-tail impact. A major contributor to the SVAC burden was schizophrenia. SVAC accounted for 4.15 million dailies linked to that condition.
That connection, that association between early life trauma and a severe mental illness like schizophrenia, that's a detail that really should stick with you, the listener. It moves the conversation beyond just general distress and into profound systemic health damage.
The evidence strongly suggests that severe early life stress, like SVAC, acts as a major risk factor. It seems to fundamentally alter brain development, especially in areas that govern emotion and reality perception. So the findings here elevate the conversation about trauma from being purely psychological to being neurodevelopmental, physiological even.
So if we connect all this to the bigger picture, these findings are more than just an academic exercise. They're a loud, clear, quantitative call to action.
They have to be.
The sheer scale, the high ranking, the specific debilitating consequences, it's all strong evidence that IPV and SVC have to be formally elevated among top-tier public health priorities.
By every global and national leader. The data is simply too massive to ignore. I mean, when an avoidable risk factor ranks 4th globally among women of reproductive age, it demands immediate resource allocation.
So what does this all mean for policy? The big takeaway for me here is that violence is an avoidable risk factor. Unlike some things we can't fully control, violence can be prevented.
And the potential impact of investing in prevention is enormous. This study essentially provides a global ROI. Investing in prevention could avert literally millions of dailies and reduce a lot of premature death every single year. That's a huge, measurable gain in global health.
But the investment needs to be smart, right? We can't just focus on reactive measure.
Absolutely not. The investments need to be two-pronged. Yes, we need primary prevention programs that challenge harmful norms, promote gender equality, teach healthy relationship skills, stop the violence before it starts.
But what about the billion people already affected?
Exactly. Equally important is comprehensive investment in interventions that support the complex health and social needs of the survivors. The 1.1 billion individuals already living with this burden.
And given that mental health disorders are the biggest part of that burden, it seems impossible to address this crisis without dramatically scaling up mental health infrastructure.
It is impossible. If you look at the costs associated with chronic anxiety, depression, schizophrenia, all driven by trauma, the economic and human costs are astronomical. Investing in trauma-informed mental health care is not a luxury. It is a necessary public health intervention.
Okay, so let's do a final synthesis of the key points for you, the listener, to take away from this deep dive. First, remember the prevalence. Over 1 billion lifetime survivors of childhood sexual violence alone.
An incredible number.
Second, remember the ranking. IPV and SVAC are the 4th and 5th leading risk factors for disease burden in women aged 15 to 49. They rank higher than things like TB and road injuries. And finally, know where that burden primarily lands. Squarely in chronic mental health crises, driving huge global rates of anxiety, depression, self-harm, and even schizophrenia.
This study decisively shifts the focus. It shows that the greatest share of the burden of violence comes from these mental health disorders that diminish decades of healthy life. And that raises a really important question for global leaders to confront.
What's that?
If investing in prevention and comprehensive support for survivors of IPV and SVAC is a proven, high-yield way to avert millions of dailies globally, then how should we fundamentally redefine public health infrastructure to prioritize social support and mental health care as the primary, most effective prevention tools we have against violence?
A critical question for all of us to consider, especially when we look at how resources are allocated globally. Thank you for joining us on this deep dive. We hope you take these facts with you and really reflect on this critical link between social risk and global disease burden.